Good morning, everyone. I'm Nitesh M, final year BDS, Chetna Dental College and Research Institute. Today, I'm going to talk about the topic obturating techniques. What is obturation? According to American Association of Endodontists, obturation is the method used to fill and seal a clean and shaped root canal using a root canal sealer and core filling material. Purpose of obturation: to achieve three-dimensional fluid seal of the root canal, to prevent bacterial microleakage, to achieve total obliteration of root canal space as to prevent ingress of bacteria and body fluids into the canal, to replace the empty root canal space with inert filling material. Criteria for obturation: the criteria will be the canal should be reasonably dry, no whipping of fluids in form of bleeding or serous discharge. The patient should be sensitive free on percussion, teeth with no periradical radiolucency. After optimal cleaning and shaping is achieved. Factors influencing the efficacy of primary root canal treatment: absence of pre-treatment periapical lesions, root canal filling with no voids, obturation to within 2.0 mm of the apex, and adequate coronal restoration. The spreaders. Spreaders are basically used during the procedure of obturation. There are two types of spreaders. One will be the hand spreaders and the finger spreaders. Finger spreaders provide better tactile sensation and are less likely to induce fracture in the root when compared with more traditional hand spreaders. Spreaders made up of nickel titanium are available and are considered better when compared with stainless steel as they provide better flexibility, decreased stress, and deeper penetration. Techniques of obturating. So this is the important topic. I'm going to talk about today. There are total eight types. One will be the cold lateral compaction, warm compaction, continuous wave compaction technique, thermoplastic Gatapaka injection, carrier-based Gatapaka, Mexperian thermomechanical compaction, chemically plasticized Gatapaka, custom cone. The first will be the cold lateral compaction. It provides length control during the compaction. Disadvantage will be it may not fill the canal in irregularities as well as warm vertical or thermoplastic techniques. It is not able to achieve a three-dimensional seal. Clinical consideration will be the sealer consideration. Sealer application of the canal wall can also be performed using a lenflosphere or with the master Gatapaka cone itself. Spreader consideration. Size of the spreader is determined by the width of the prepared canal and lateral foot of the primary cone. The greater the space between the canal wall and the butt end of the Gatapaka, the larger the spreader used. The spreader size should be reached within 1 to 2 mm of the working length in order to obtain optimal apical compaction. Master cone consideration will be minimal force should be used on the spreader during the compaction process in order to avoid root fracture. Additional secondary cones are inserted until the spreader cannot be reinserted. It is an indication that the root canal is fully compacted laterally. Several radiographs must be taken while obturation. This is the Gatapaka which is used during obturations. And limitations will be presence of voids in between the fillings as it may not fill the canal irregularities as well as warm vertical thermoplastic techniques. Does not produce a homogeneous mass. The second will be warm compaction techniques have a better ability to seal intercanal defects and lateral canals than cold lateral compaction. So next we will move to the warm compaction method. It is basically of two types: warm vertical compaction, warm lateral compaction. First will be warm vertical compaction. It was given by Schilder. It is a method of three-dimensional filling the radical space. Preparation requirement will be preparing the canal with a continuously tapering funnel and keeping the apical foramen as small as possible. Instruments required will be variety of pluggers and heat source. So this is a picture of warm vertical compaction, how it is done. Syndication. Alternative to cold lateral compaction technique, when the fitting of a conventional mask cone to the apical portion of the canal is impossible, as when there is a ledge formation, perforation, or unusual canal curvatures, internal resorptions, or large lateral canals. Technique will be primary non-standardized or greater taper or Gatapaka cone corresponding to the last instrument used is fitted into the canal in the usual manner. The canal wall is coated with a thin layer of root canal sealer. The primary Gatapaka cone or master cone is inserted up to the working length. The coronal end of the cone is cut off with a heated instrument. So heat carrier such as a root canal plugger is heated to redness and is immediately forced into coronal third of the Gatapaka. And the coronal Gatapaka is sheared off by the plugger as it is removed from the canal. A vertical condenser or plugger of suitable size is inserted and the vertical pressure is applied to the heated Gatapaka to force the plasticized material apically. The alternative application of heat carrier condenser is repeated until the plastic Gatapaka seals the larger accessory canals and fills the lumen of the canal in three dimensions up to apical foramen. The remaining portion of the canal is plugged with warm sections of additional pieces of Gatapaka. So the advantages would be excellent seal of the canal apically and laterally, obturation of the larger lateral and accessory canals. Disadvantage will be the amount of time it takes, risk of vertical root fracture, periodic overfilling with catapaka or sealer that cannot be retrieved from the periradical tissues. So next will be the warm lateral compaction. It provides length contributing obturation, and the device is placed beside the master cone and activated, followed by placement of an unheated spreader in the space previously occupied by the heat carrier. Accessory cones are then placed and then process repeated until the canal is filled. So the next will be continuous wave compaction technique. This is a variation of the warm vertical compaction technique introduced by Buchan. Employs the use of Gatapaka cones and pluggers that mimic the tapered preparation, thereby permitting the application of greater hydraulic forces during warm compaction. So it uses a nickel titanium system to prepare the canal. Pluggers are selected in consistence with the size of the shaping instrument used. Tapered pluggers size 0.3 to 0.06, 0.08, 0.10, 0.12 with the tip diameter similar to tapered Gatapaka points respectively are employed. This procedure is carried out with a heat carrier system. So the next will be the thermoplastic Gatapaka injection technique. Principle will be this technique compromises a pressure apparatus consisting of electrically heated syringe barrel and a selection of needle ranging from 18 to 25 gauge size. The plunger is designed to prevent the backflow of the Gatapaka. The degree of heat is regulated to provide proper extrusion of the Gatapaka according to size of the needle. Technique. Example will be obturation 3. Obturation Spartan was commonly used. A suitable gauge needle is selected to be positioned at 3 to 5 mm short of working length. Temperature is around 200 degrees Celsius. In injection method, the canal preparation is restricted apically with flaring of the body of the canal towards the axis opening. The next will be carrier-based Gatapaka technique. Thermophil thermoplastic technique. It is a carrier-based Gatapaka observation system comprising a plastic core carrier coated with alpha phase Gatapaka. It is available in ISO standardized sizes as well as variable tapered sizes, suitable for canals prepared with nickel titanium tapered instruments. Used in conjunction with a heating device known as Therma Prep Plus oven. The next would be sectional observation technique. This is a carrier-based sectional Gatapaka observation system used in conjunction with a light-speed rotary instrument. The simple fill carrier has an apical 5 mm plug of Gatapaka which performs cold sectional observation of the root canal. The carrier size is chosen according to the diameter of the master apical site. After drying the canal and applying the sealant, the carrier is applied up to the working length. The handle of the carrier is rotated quickly in the counterclockwise direction 3 to 4 times to disengage the apical plug of Gatapaka from the carrier. The remaining corner space can be fitted with lateral compaction or thermoplastic Gatapaka methods. The next will be McFadden thermomechanical compaction method. This method used heat to decrease the Gatapaka viscosity and increases its plasticity. The heat is created by rotating a compacting instrument in a slow speed contra angle handpiece at 8000 to 10,000 rpm alongside Gatapaka cones inside the root canal. The compactor whose spiralated 900 flutes here, similar to the flutes on its Stromfeld, but in reverse, forces the softened Gatapaka apically and laterally. As the compactor blade breaks easily, if it binds, this method should be used to fill straight canals only. Step-back method is used to enlarge the canals. Gatapaka cones are inserted in the prepared canal short of the root apex, and compactor blade selected according to the width and length of the prepared canal is inserted between the Gatapaka and its canal wall. With a stop on the comparator blade, the rotating tip of the blade is guided within 1.5 mm of the root apex. Restriction of the blade within the canal prevents the forcing of thermoplastic Gatapaka through the root apex. The plastic Gatapaka moves laterally and apically because the reverse force on the compactor blade pushes the softened Gatapaka forward and sideways even when one is withdrawing the rotating blade from the canal. The advantages would be ease of selection of Katapaka cones, economy of time, rapid filling of canals apically and rapidly. Disadvantage will be inability to use the technique in narrow canals, frequent breakage of compactor blades, frequent overfilling of the canals, shrinkage of the cool set filling. So this is the mixed pattern compactor which is commonly used. Chemically placid Gatapaka technique. Gatapaka can be placid with chemical solutions such as chloroform, eucalyptol, or xylol. The advantage is that it can be used in unusually curved canals. The disadvantage of using a chemical solvent filling material is its inability to control overfilling with the resultant periapical tissue reaction and shrinkage of the filling after setting, resulting in poor apical and lateral seal. The custom cone technique. This is the last technique. Custom cone technique is a chair-side procedure employed for customizing the gatapaka and wide angles where traditional master cone cannot be adapted. The clinician has to customize the gatapaka point or to tuck back. So this will be the reference I took from, and thank you for watching the video.